Hi, everyone. Happy Friday. This is your girl Win here today. Want to start up this podcast tonight by saying happy Friday. Um, we're here doing what we do on a normal basic. We are the Inner Circle podcast. We are here Monday through Friday. I am your host every Friday night. This is social segment with Win and Patience. So you will see me every Friday, and we're just here to have a good time, a good conversation. Tonight we're going to be talking about a topic I feel like that should be talked about. Um, it's a topic that is commonly talked about within the United States. And I think being as Liberians, I think it's only right that we do shine light on this topic, no matter which part of the world we find ourselves, which, no matter the regions we also find ourselves, where we come from is always going to be a part of us. And we're Liberians, whether we live in the US or not. So we're just going to talk about a topic I think that needs to really be brought to the spotlight. And just bear with me really quick. I am just sharing the videos and see whoever wants to join. And if you are watching, please share it tonight. And I just want us to have a quick conversation. And on Fridays, we're here just for an hour. I'm not here long. I'm not here to take up your time. I know people are busy. There's a lot going on right now. It's Friday, it's a weekend. So we just want to chat with you for a week, just for an hour. And if it goes long, so be it. I mean, it is Friday and it is social segment. But tonight, I really want to dive into this topic. The topic we're talking about tonight is the HIV cases that is rising in Liberia, right? I know we live in the United States. Oftentimes, um, we live in the US. We're taught like we have like those teachings, right? We have those teaching of like sexual transmitted diseases. Like I feel like when we're in elementary school, not really in the elementary school, but like middle school, a little bit of high school, they start introducing sexual transmitted disease like as a conversation, right? They start teaching us about it. We start learning about like how to properly like what is called safe sex. We start learning about safe sex, and I think the country of Liberia, that's a conversation we're going to have tonight. There's a high rise of HIV taking place in that little country, right? If you're watching tonight, join the conversation. Share this video, of course. This is your girl, Wen, holding it down. My panelists are coming, so we're going to have a chat tonight. But if you're watching, just share the video, share the live, interact with me. Just disclaimer, please, if you're in a comment, please be respectful. If you have a comment, please post your comment in there. But please don't get in a comment being disrespectful, because I will willfully block you. And I'm being crystal clear. If you're going to comment, please be very respectful. You're free to state your opinion. You're free to say exactly how you feel on a topic that we have on this show. But one thing you're not free to do is to be disrespectful. That's for sure. Two things for certain. So if you're watching and you want to comment, you're free to comment. Drop your comment and I'll post it on the screen. But if you're commenting and is disrespectful, you're being rude, or just not following the guidelines, I would definitely block your page and you can no longer comment on this segment. So just so we're clear with that. But yes, tonight we'll be talking about the HIV cases that is rising in the country of Liberia, right? In the US, we also know America also have high cases. We have many states in the United States that also have a high case of HIV rate as well. But tonight we're going to be shining light on our homeland, which is Liberia. So the cases are very, very high, and that is scary, right? That is scary. I'm just going to read the source tonight that this this topic is being pulled from. And it's from Instagram. The page is Gossip Liberia. It says the National AIDS Commission reports that an estimate of 36,000 Liberians are now living with HIV/AIDS. That was an increase from last year. Last year it was 34,000. Now there is 36,000. 36,000. So 2,000 more has been added to that number from last year. It says that Dr. Cecilia Nuda highlighted that women continue to be the most impacted. So not only 36,000 Liberians in Liberia are living with AIDS, but it's the women are the most impacted. And I'm just curious tonight, if you're in the comments, drop your comment as to why is it that women are the most impacted, right? Is it that women are not practicing safe sex? Is it that women are like exchanging partners? Is it that women are not like, checking themselves, periodically? Like, what is going on? Because the article says that the women are the most impacted and they're calling for targeted interventions and a stronger domestic support as the country prepared to mark World AIDS Day on December 1st. Right, so that was a lot. Let me just give you a snippet. So the first and foremost, Liberia has 36,000 Liberians living with AIDS, and the most impacted of this is women. Right, it's women. It's the women that is most impacted, and so there's a doctor named Dr. Cecilia Nuda. She's asking for interventions, right? Like, how can we intervene? I mean, I think this intervention go beyond the country of Liberia. I think it also comes within the Liberians that is within the U.S. as well. So, like, how can we like put together our resources, our brain to help that country, right? Because that is a large number, 36,000 people. I don't even know the population of Liberia currently. I'm gonna go check. So, if there's 36,000 Liberians living with HIV and are not even aware, that is scary. That is scary. What's their current? We're going to look for the current population. Okay, y'all. The current population is large. So it's 5,778,526. That's the amount of people that's currently living in Liberia. So out of that 5,778,526 people, like that's the amount. So I'm gonna post a thing here really quick. So it's 5,778, come on, 527. Current population. So that is the current I'm going to just post in the comments the current population, right? So that is the current population of Liberia as of 2025. So if you look at this number, 36,000 from this number is infected with HIV. And women are the most impacted as we speak. So I'm curious tonight, viewers, if you're in the comments, drop your comments. Like, why is it that women are the most impacted? Like, why is it that women are the high, out of that 36,000 people that have HIV and have the AIDS, women are at the highest rate. Why do you think so? Is it that women are not like taking care of themselves? Are they not checking themselves frequently? Are the women not doing proper care to make sure like the person they're sleeping with or having sexual relations with, that person is not taking care of themselves? Like, why is it that the women are at this peak, right? Not only there's a rise, but the women are literally up there as well. Like, women are up there. Don't get me wrong, this live is not specifically about the women, but I'm just curious because in the article it says that women are the most impacted as we speak of this virus. Women are the most impacted. Is up there. So it's kind of like, okay, what is happening? Are the women not checking themselves? Or are we like changing partners frequently without really thinking about it. Because the thing is, within the United States, even though there's a high cases of that, luckily you can get checkup. You can get like, I know certain jobs when you're applying, they make you do like medical tests. So certain jobs, like they won't just let you um, apply with also medical work being done. I think like in the medical field, certain things they do like TB tests and like other tests. So like through those tests, sometimes employers or people can find that they have some level of STDs, and sometimes too the women in the United States too, like with the beauty of healthcare, they're able to get like checks. You know, sometimes a woman can get pregnant and then she'll go do like a scan or she'll go do like a pregnancy test and they will run all of those tests. And in those tests, they'll tell you, hey, you have this, or you have this, or you have that. So sometimes, so that is somewhat of the beauty of the United States, right? That people can get these tests done frequently because there's other ways that it can go about rather than Hi, welcome, Mr. Sam. How are you doing this Friday evening, night, whatever? We can't hear you, sir. Well, Sam will be back. But yes, so like I was saying, in the United States, people have more access to healthcare. And I think back home in Liberia, I think that is one of the biggest struggles, right? There's a large limitation on healthcare. There's a lot of people that don't have the fundings to get the proper health care. And then the healthcare systems don't sound like it's the best there. So I think there is reason why like this, this number of HIV cases keeps going up, right? I think the first interventions we can look at tonight would be how can we improve the healthcare system? Like, I'm curious to know.
Can you hear me?
Yes, we can hear you.
Yeah, better.
Welcome.
Uh, are you live yet?
I am. I've been talking for like 12 minutes.
Oh, all right, cool.
You
Well.
want to briefly
Folks,
introduce
what's up,
yourself?
man? How many people got here? What we got going on?
Well, we're talking about the
You know,
cases, the HIV cases that
what we got
is
going on?
taking
What we got
form
going
right
on?
now in
Happy
Liberia.
Friday, though. My name is Sam, and I'm
Are you telling the
riding
viewers
with
Happy
Wayne
Friday? Or are you
tonight.
telling me Happy
Uh,
Friday?
Happy Friday to you, Wayne. Happy Friday to our viewers as well. Hope everybody's doing good. My internet looks like it's slow. I don't know what's the reaction out there, but I hope it's good. Um, yeah, happy Friday, folks. We're here joining Wayne, talk about some critical issues. So yeah, Wayne, I'm here whenever you want my input. Jump in.
Yeah, we can dive in. So I
Absolutely.
was just sharing that the article that was shared today about like the HIV, AIDS, like the increase that that's currently taking place in Liberia. It said that last year that was 34,000 cases, and then this year is 36,000 cases. And then the article also said that women are the most impacted. And my question to you tonight is like, why do you think women are the most impacted? That's what I'm trying to get understanding.
I don't know. Frankly, I didn't. That's the case with Liberia, right?
Yeah, the Liberian the
I
current.
like to think. I like to think. I like to think that for the simple fact that there are more women in Liberia than men. Actually, when you look at the census, the last one that was taken, there were more women than men. Maybe that's why. Because people who are getting those things are equally not preventing us, So we can't say more women are preventing those than women. I think that there are more women than men,
Sam, I'm
and
so
so
sorry.
that's
Your
probably
your
why.
internet was staticky, and
Jump in.
Your internet is really staticky, and everything you said, I don't know if like you were.
Jumping. I don't know if it's me.
I think you should log
You
back.
know,
You should go back in. You froze for a second, so maybe you should try coming back in. Okay, I think you're moving. Hi, Adeline. You can join. What is your? I can send you. Do you want to call or do you have your Facebook? I can. Let me log in. Hold on. Give me. Let me find you on Facebook really quick, and I can send you the link. I'm gonna send you a link, and when you click it, just it will bring you into my platform, Adeline Yearly, and you can join this conversation tonight. So once I sent the link, just please click it, and it will bring you in. But tonight we're just talking about the cases that is happening right now in Liberia. So, oh, we have a different system. I'm coming. I will send it to you. So I just send it in your inbox, Adeline. If you want to just click your messenger, your inbox, and we'll bring you right to my system. And then you should be able to comment. And then we can join this. And you can definitely join me on this conversation tonight. So we're talking about the HIV and AIDS cases that is happening in Liberia. Once again, if you're just joining us live, there is about 36,000 Liberians currently living with HIV/AIDS in the country of Liberia. We don't know if they're aware that they are, a carrier of this disease, or if they're not aware. But we're going to talk about that tonight because the article said that women are the most impacted currently as we speak. Not only there's a high epidemic and it's on a rise and it's growing daily, but women are the most affected. So the women in Liberia are carrying a higher rate of HIV/AIDS, knowingly and unknown to themselves. So that this is the conversation tonight. If you're in the comments, if you have any support and resources, or you would love to join this conversation, let me know. I can send you the link, and you can click it, and it will bring you to the studio, and then we will join you on the live. So it's a little bit different than when we go on live on a regular Facebook. We're on a different streams. So please let me know if you want to join. I will definitely inbox you that link, and it will bring you directly to the waiting room, and you can join it live. But tonight we're talking about the increase that we're seeing in this disease. We all know HIV and AIDS. We all know like the outcome of that is start off as HIV, and then I think HIV is a virus, and then the AIDS is the longevity one. So we just want to talk about like why is it that women are more impacted than men, or is the men impacting these women? Is that what is going on as well? So I'm just curious to know tonight. In the article we're pulling from, it sounded a little bit cheesy, so bear with me. It says, the article says Gossip Liberia. That is a page on Instagram if you wanted to know where I'm getting this from. And then they were talking about like last year, Liberia had 34,000 cases. Now this year, Liberia has 36,000 cases. So just in a year, 2,000 more cases has been added. And I don't know if that number is going to go down anytime soon, but there is an increase of HIV/AIDS that is happening within the country of Liberia. And one of the doctors there, hi, Adeline, how are you?
Hi, how are you? Well,
I'm good. I want to welcome you tonight to my Friday social segment. So usually on Fridays, I'm here having a conversation. Just could be any topic. Tonight we're just
okay.
talking about the HIV cases that is currently pandemic that is happening in the country of Liberia, right?
Okay.
The article is saying that there is 36,000 cases of HIV currently taking
Yeah,
place.
I read the article.
Yes, and like and women are like highly impacted. So what let me hear what's your take on that? What do you think?
So I'm just gonna introduce myself.
Go ahead.
I'm new to the platform. My family, Abraham, we're family, so
Okay.
that's why I was excited. I'm like, oh, I finally
Oh,
caught
okay,
your
yeah.
stuff.
Good to see you. Are
But
you his
then he's
cousin?
not
His
hosting tonight, so yeah,
How are
he's
you
not
connected
hosting
to
tonight. But
Abraham, if
that's
you don't mind
okay.
me asking?
He's actually my brother.
Oh, okay, nice. Okay, well, welcome. I'm Win.
Yeah,
Nice to meet
thank
you.
you, thank you. So I do have a medical background. I'm a
Okay.
registered nurse. So the healthcare part of it, I really do understand it.
Okay.
And in the recent year, I've gone back to Liberia twice.
Okay.
And I did a one last year, March, April.
Okay.
It was a medical mission. It was a surgical medical mission I was there for. So we worked with supposed to be JFK Hospital, but we end up going to the other hospital. Gosh, I can't remember the name, but it will come to me in a second.
Okay.
And then we were working with the True Clinic there. So and I have a lot of insight when it comes to just that experience alone with Liberian healthcare infrastructure, the way it's settled right now.
Mm-hmm.
It's concerning, right?
Okay.
When you talk about STI, STD, and the spread of diseases, when it comes to that, it's a whole circle, like a picture of circle. Education is the first start of that,
Mm-hmm.
right?
Right.
And
Right.
within education, you have a group of people who are not educated on
Yep.
just health, period,
Right.
right?
Mm-hmm.
It's not something that is readily available, whether it's safe sex or protection.
Mm-hmm.
Um, and then when you leave the education aspect of it, you talk about like health education, sexual risk health, easily accessibility to condoms.
Mm-hmm.
And then
Mm-hmm.
on the social aspect of it, like, let's be frank, Liberian, we do have a culture of that's my man, your man, we sharing man,
Right. 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 Right.
right?
Right.
It's comments where you have, and I was there and I've seen there where this neighbor is running to that person's house and that neighbor, it's like everybody in the community is sharing
Okay.
like this.
Okay.
Um, Culturally, it's become part of the gossip mill where we all like talking about, oh, can you believe this one did that one took this man,
Right. Right.
right?
Right. Right.
And when you have such like freely body fluid
Right.
is being shared very freely, um, the disease is going to spread just as easily, right?
That makes yeah.
Because
That's
the
fair.
unawareness is that I trust him or I
Right.
trust her.
Right.
This
Right.
man don't look like this. This
Right.
woman don't look like that.
Right. Absolutely.
And then you have the younger kids that get affected by it, right?
Right. Right.
Um, so you have infants who are born, right? A lot of it, RCT has been really, really good medication, but I
Mm-hmm.
don't know how much like we've been able to have those medications readily available for positive women who are HIV positive to have access to those medications.
Mm-hmm.
I don't even think we have the infrastructure to do that. For example, Botswana is one of the countries that built infrastructure that has been able to stop the spread of
Mm-hmm.
HIV like really well because they work with the United Nations so well that they're able to provide RCT to women when they're pregnant and when they have the babies do not become positive. And then you have an underlining of what I call keep it in the family, right?
Right.
Sexual assault, rape, all of those things, where you have young children who are becoming positive from adult men because somehow we haven't written rule or unwritten rule about grown men sleeping with children
Right.
who
Right.
has not understand their sexual health, who sometimes the family even push them into it
Right.
because go get money, we need it.
Okay.
So it's a cultural, it is on the health level,
Okay.
and it's really gonna take like not just the education aspect. The education is definitely going to be first, but it's going to take real like structural work, whether it's providing condom, providing prevention medication. Like right now, we have medication in the United States where those population of people, if they have access to that medication, they can't spread the disease anymore because
Right.
it
Right.
prevents the next partner from getting it. But how are we going to get access to that? What is the funding,
Okay.
right?
Okay.
These are all of the questions that I have that I think all of us need to be asking before we
Right.
even like start the conversation. You
Right.
know, who's doing the testing? After the testing, what does the funding looks like? Are we just gonna
Right.
point finger like, oh, look at that one over there, she could be this, look at that one over there, she could be that? Think about it. Has that ever really stopped human from being sexually active?
No, it happened,
Not
and
really.
I really appreciate patience. Welcome. Tonight we are talking about the cases of HIV/AIDS that is a high rise in the country of Liberia, and we have Adeline, which is the sibling of Ibrahim, the men that give us hard time all the
Oh,
time.
okay.
So she's coming in with a background in nursing, and she's just educating us. And I believe last year she was on ground in Liberia, so she saw like firsthand like some of the how like the healthing system is running the country of Liberia. But according to the article that we're trying to just reference tonight, it may not be fully supported, but it's indicating that women are mostly impacted, are like the most carrier right now of HIV and the AIDS. And it says that 36,000 Liberians are currently living, with such. And my question is like, are they aware or unaware? So Adeline just touched some points here, like, how, where we can pin maybe why women are mostly affected, because you have people that are willing to share their partners. You have people that are, blindly trusting, I would say, that person they're with, that they're not doing nothing. They don't look like the type. They're faithful to them. You have people that are, other people like date people for like the younger age because X, Y, and Z. You got people, I'm sure, like that are mixing the genders now. You got people that are like, hey, we need some money. So if this man that has money trying to get to you, don't know like what that person's coming with. So it's like the women are at a high risk. Is it like from all of these things? So that's kind of what she was talking about when you jump in. So
Okay.
Okay. So when it comes to the fact that the women are mostly effective, I'm gonna say not true.
okay.
In the sense I'm saying not true because women are the one who go to the doctor. Women are the one who go to get tested.
Okay.
Women are the one who go for healthcare. Men are not showing up on the radar or the hat number because they're not going. They're waiting until they're on deathbed. Like even regular healthy men, okay? How often do you see them go to the doctor? Like even in this country, right?
That's true.
Men are dying from a high rate of prostate cancer for something that's so curable, so simple. In this country, they're not even going to the doctor for that. So that's why the number is skewing that way, right? When you look into the data, women are seeking healthcare. They're worried about, oh, this cough is not going away. I'm not,
Right.
I take this medicine and I'm not getting any better. Let me go to the doctor and see what's going on, right? Other than that, men are like, chuck some country medicine, yeah, go work, it will go. they're not they're not really seeking the services like that. So it's going to show up. And I'm afraid that how this number is going to come off, it's going to come off more negative towards women who are actually the one who knows. And
Right.
because now with awareness, they can prevent it. They can
Right.
actually seek out services versus the men who are carriers and carrying, who are not getting tested, who are not going to the doctor. They will be the ones spraying it to the women, and the women will always be showing up in a number. So
Right.
like when we're like, show like this is good. When you guys are talking about things like that, I really want y'all to carry the narrative for like everything that come behind the scene, because as much as I kind of hate it a little bit, online spaces doesn't always come with facts, and you want to be able to make sure like you're weaponizing the people in a good way, where you're giving them information like, oh, the number is higher because women are going to the doctor. Let me see the
Right.
men and get line up now. Y'all go
I don't
line up. Let me see
no,
y'all and
and
go
you're
get
not
tested.
wrong. I think when I started, so I was opening it in regards to trying to, because it's out of curiosity. Like, so one of the fellow
Okay.
members in the group shared the link, and it's like, whoa, guys, this is big. Let's talk about it tonight, right? So we
Mm-hmm.
can't just come on. We're not coming on. I'm not coming here to say the number women are the one. Da, da, da. No, but because you are
Mm-hmm.
right. Even in the United States, we see women are getting checked. And previously, when I started the live, I stated that oftentimes women are being aware because sometimes you go get like tested for like a regular thing, and
Mm-hmm.
this, there's other tests that can be run, and this can be present in your, found in your bloodstream or whatever it is. So I'm not,
Mm-hmm.
I've emphasized that in that piece of it, but I think sometimes too, and you're right what you're saying, men don't test, so women are the one testing, so that's why this number is high. But if we actually take a and test actually both gender, I'm sure
Mm-hmm.
that the most carrier is not the women, if you
Mm-hmm.
look at the number, and that's accurate because even in the United
Mm-hmm.
States we see it here. Like there are women
Mm-hmm.
that will like do their annual 6 month checkup or annual, yearly checkup.
Mm-hmm.
And we all know some jobs when you're working they're required to do some medical checkups, right? I think
Mm-hmm.
that like TB tests and some other scans,
Mm-hmm.
and whatever is there it will pop up. Or if you're pregnant, you go do like a pregnancy test at the hospital, they will run all those STD screenings, and if something is there they will tell you, right? So women are mostly
Definitely.
checking, which is accurate. And in the US we see it where the medical is giving to the discretion, they're not even running to grab it, right? So yet alone a country where it's like scarce, or if you have it you can go, if you don't have it you can't, it is not taking
Mm-hmm.
place. Most likely I believe that number that saying women are mostly impacted is because they're checking, but I think the men
Mm-hmm.
is the most one impacted because they're carrying it, and they're going from
Mm-hmm.
Miriam, Musu, Jezebel, and Musu. Patience, what is your take on this tonight? Like you just coming in, like what do you think? Where are you coming from?
Well, well, she said, the men, because once again in the African community too, this is some of the thing in the African community, we don't take like health seriously.
Hmm.
Is all, especially back home, every little thing, country medicine, they feel like country medicine fix everything. And the unfortunately the healthcare system in Liberia suck. There's barely a good healthcare
Barely any.
system, yeah, back there too. So with all of that, it prevent people from going to the hospitals and getting these necessary checkup that it's supposed to. And in the United States here too, and she said that it too. Men don't take their health serious. It's
Yeah.
very, very hard for you to see a man go to the hospital every year, every year to do his physical or at least see what's going on. And if most of these things popped out, it's probably the woman who found out about it. She went to do a physical and find out that she had it. Now she got to contact the person she was with, and he himself probably don't know. And they do have some people who are selfish. They have some people who are selfish. They know that they have these diseases, and they're choosing to spread it around and just go and sleeping with
Mm-hmm.
people. And then one person get it, the next person get it, the next person get it, instead of like letting people know from the jump that okay, this is my situation, I am being treated for it, and give that person the opportunity like, okay, let
Right.
me see if this is something I want to like get myself into or not. But we're not doing that. I think it was like, if I'm not mistaken, it was like years ago, there was a guy who had AIDS in Brooklyn Park, and he was sleeping with people without telling them that he had AIDS. Yeah,
Oh my goodness.
yeah,
It was upstate New York. I heard that too. It was a white
yeah.
community though. That guy I heard about, he spread it throughout all those sucker moms.
Yeah,
Wow.
the African community in Minnesota
Mhm.
here in Brooklyn Park, a few years ago, if I'm not mistaken, it came out that man was sleeping with any and everything until it was known that he had AIDS, and all the people he had slept with had already cut it at that time. I mean, it's too late.
Wow.
So for me, my recommendation is start testing your partner. I mean, if you guys get to that place where y'all want to be intimate, y'all go do your physical. We the women, we need to start dragging these men to the hospital with us.
Hmm.
That's where it's getting to now, because whatever they have, we gonna get it. And you need to stay on it too, because if he step out there and go and mess around with somebody else, whatever he gets from out
Even
there.
after you get tested.
Right.
Mm-hmm.
Even after he gets tested, whatever he get from out there, he's bringing it home. He's bringing it home to you. So just because you test at the beginning of the relationship, you need to constantly, even if you believe within yourself that your partner is the most fit for person, you need to constantly stay on it too, because it's getting scary. It's really getting scary. People are not communicating these things. People are not putting awareness towards it. And most of these things do the Decemberies, then go to the library and go do the Decemberies things
Not
and bring it to
December.
us on this side too. So all of those things are just yeah, it's sad. When I saw that thing in the group chat today,
Self-intertwined.
it was heartbreaking that our country has that many people. That's a lifetime sickness right there. That's not something you can get cured. So I'm hoping they can improve the healthcare system in Liberia and try to figure out how to stop that.
And then
And
it's
you, eh,
according to
sorry,
the
go
World
ahead.
Bank, briefly,
Hmm.
it said according to the World Bank, the ages range is like 15 through 49. Like,
Hmm. That's the
it,
average sex age.
huh?
Yep.
Average woman sexually active, basically.
Yeah, yeah.
Yeah.
Because that's what the World Bank is saying here today. Like, that is that it start that young from age
From
15.
from the research standpoint, though, what I'm wondering, because here's the real reason why these number really matters that come down to it. Because remember, USA was pulled, right, when the whole Trump administration took over and TREF was happening.
Yeah,
So I'm assuming that gathering these data is a way to push the UN to try to
Mhm.
install more US aid to try to
Mhm.
get medication back in and see that AIDS is spreading at a higher rate now, and access to medication, because I know a couple of physicians, because I was there, I work with them, that it's saying like access to these antiviral medication is very difficult right now because
Mm.
AIDS were just stopped and removed. Even a great country like Rwanda, Botswana, excuse me, had to go
mhm,
through I think the UK to get their medication, or Canada, because the US aid has stopped paying for those antiviral
Mhm.
medications. So I guess the exposure of the number and being able to like put those data together is to say, hey guys, like we really need this aid. This is what's happening. The country is going down. This is how lack of access is starting to really affect the people. And ultimately, women and children move the numbers. Men,
Yep.
people don't really feel sorry for men, but that's a conversation
Right.
for another day. Right? That,
You
if you
give
say a
yourself a
lot
man,
of men and
ma.
the number is high for a lot of men, they're gonna be like, what they doing?
Mm.
What they doing? What have
Mhm.
men they
yeah,
doing, right? But
right,
if
right.
you say women and children, they're gonna go, oh gosh, we have to help them. So
Right.
I'm hoping that is the positive aspect of this number being politicized and being made aware that we actually have advocate on the ground. Now my sister's in Liberia right now. She's been doing a lot of conferences, like with the farming industry, with like minus and meditation, and she was just at a Diaspora conference there too. So she's got boots on the ground and trying to bring more awareness to stuff like that. So I'm gonna contact her and see like who is the advocate that
Mhm.
it's going to the UN or is going to have this meeting and saying, look, this is what the number looks like. Like what hospital, who, because I feel like Iberian hospital operates so individualized. Like what does the health ministry do
Right, and
exactly?
it
Like,
should be like everything. I think sometimes because Liberians have this me, myself, and I mentality as we found in our
mm-hmm,
Mhm.
culture, and it's like that's one thing we give to the United States. Even though everybody have like whether it's Park Nicholas, there's Methodist, there is this, or that it. There's a chain that they all fall under, and they have one common factor,
Yep.
mm-hmm,
common goal, right? Which is the wellness of the people. And I
mm-hmm,
feel like Liberians we miss that mark a lot. It's not me, myself, and I in the field of healthcare. If one
Right.
health
mm-hmm.
person, one people don't have it, pass it. You can pass the record line and try to help the next person. It basically should be like a chain rather than an individual system. And that
Yeah,
is a great question of what you're asking. What is the I don't know, say
the
ministry?
end result. I applaud everybody to get the number, okay,
Mm.
of the health department in Liberia. Call them. What are
Yeah,
they
I
doing? What is the
know.
advocacy? Who's marching? Weren't they just marching for drugs
Drugs.
against
Yep.
youth or having drugs?
Hmm.
I saw people march. I never seen that much people march in Liberia ever again. If they can do the same thing, the same youth
It
lives
really
are being
can. It
affected,
really can. There's a high
can
rise
come
of
and do
drugs
the
right
same
now
thing
in our
too.
country. There's a high rise of HIV and AIDS. So
Yeah. It's the same comorbidity because drugs can lead to HIV too. You share the needle, I share the needle, you
yeah,
get
Yeah.
it that way too.
people
So
are just passing it down
yeah.
generation.
And could
So
that be
I'm
could
gonna
that be
find
a
out
thing
who.
too though? Could that be the some of the reason why it's spreading a lot in Liberia? Because like you said, you share the needle, I
Because
share the needle. Type of thing.
yes,
I
but
mean,
I think
I
it's
I
more
say yes and
sexual.
no. Only reason why because like quote unquote the Zogo is higher in men. You know, I
okay.
seen them living on the beaches. It were not really a woman thing,
Thing okay.
So the
Okay.
right?
Zogos are men, not women. Got it.
It's a higher population, right? Because
Okay.
think about like drug substance use, mental disorder, they kind of like coexist together.
Yeah,
Women
yeah.
are more verbalized when they're dealing with something, they cry, they scream, they talk about it. Men are not taught how to emote, how to
Right.
emotionalize, how to get like energy out of their
Right.
body. They told to swallow, swallow, swallow. And then they migrate to drugs and crime as a way to find camaraderie around each other. So, and those people are not getting tested also, right? They're chasing their
Right.
next high.
Yeah.
It just, you said it in the beginning when you got on. I just think it's a lack of proper education when it comes to sexually transmitted disease. Because even in the United States
Mm-hmm.
here, at an early age, I think what middle school,
Hmm.
approximately high school, they start introducing that
It
conversation.
started at sixth grade.
Yeah, at sixth
Yeah.
grade, we
Mm-hmm.
start
Yeah.
introducing
Really
like
early.
sexual transmitted disease, prevention methods like condom, abstinence. They start talking about those type of conversations. And I feel like because our country we lack so much, there's only like, even though the boots we have on the ground that are doing the possible best that they can, there's still more that needs to be done. But I feel like education, like you said in the beginning, that's our first tier. When we attack the
Yeah.
higher education, then we can come down the chain of command. But it's like we
Yeah.
also have Liberians that are in this country that are
Mm-hmm.
nurses. Some are still advocating back home, and some are like got their degree and they're like, "Oh, I'm only a nurse in America." Like sprint,
Mm-hmm.
what they said: when you educate me, you educate a nation, right?
Mhm.
Mm-hmm.
You're in the hospitals, you got the resources. You like, okay, I saw these medication used. Like, how can I, connect with somebody back home? Like making an organization, make it a thing, and travel. Like, how can we create a chain or a portal to help
Yeah.
people?
There are organizations. I'm not gonna lie. There are
No,
organizations,
I'm not
but
saying there
you
are. I'm
know,
just saying we can expand more. The ones that are
the
there with comments and we're grateful. Don't get me wrong. I'm not saying none of that. I'm saying like
mhm.
there's a lot of
No, I
what.
wasn't saying
Okay,
necessarily like against your point. I was trying to, connect. There are organizations, but like what I want you to picture is like these organizations are doing the work of a country. It's like
that's true. That's
a
true.
drop in a bucket compared to a
Right.
well
Yeah,
flowing,
Right.
right? So even if we had 200,000 agencies, we are not a public health infrastructure, right?
right. Yeah,
Because within my experience, I'll get back to that. But just the idea of what public health means, right?
Mhm.
Public health is attacked from so many different levels. So the
right.
school you're going to the housing that's being offered, to the mother while she's pregnant. Like it's not just one. When you go for the food, they're telling you what to eat, how to look out for
Right.
your health. When you go to the school to drop your children off, they're having conversation and meetings and different things. So you're constantly being bombarded with more information and more things to be aware of. So, on a public health level, the need is large, and organizations can only do so much. And
Right.
here is, from my experience now, the organization who trying to do much, the hands are tied in so many ways. And I'll give you an example. The surgical hospital we were working with, which was JFK, right? We were supposed to go in there and do a lot of hernia surgery. I did a lot of intake assessment, like medication, getting people ready. And then we had surgeons that came from America here to do the surgery. We get to the hospital, JFK says, oh no, y'all can't use the surgical room anymore. We
Mm.
went over
Why?
to Redemption Hospital. Something about the room wasn't prep enough, Electra is not working.
Mm.
Went to Redemption Hospital. Redemption Hospital said every patient we registered, we had to pay for paper out of our budget. We had to pay for the printing paper just to register the person. We had to pay for
Wow.
gas just to keep the person overnight, to keep the generator going. And we bought our own anesthetic medication. When I told you people stole those medication,
Mm-hmm.
when I tell you hospital supply, we literally were like in the middle of an operation, anesthetic gone. One of the nurses working with had to run across the street to go buy one from the pharmacy to come back while the patient was under. Chaotic. One of the doctor I met in the hallway, he was, oh, they come from America. They didn't want to come here and do operation. They think they can do what they want. Free service that nobody's paying for.
Free,
But
FREE.
you're talking down to the people who are here to provide the service. There was, we literally pay our own airfare. The organization literally gather supplies to pay for those things. And this is when I tell you over 300 a day people showed up just to get assessed. Typhoid, crazy. Every person you tell, typhoid. I'm like, oh my God. This is a simple disease. Wash your hands before you eat food. Like it's
Wash your hand. No.
diarrhea.
So somebody says. The number will continue
Mhm.
to increase because individually people don't realize how important their actions
Yep.
are when it comes to eliminating the spread. Of course, strap up. Look for the limited resources. Oh, trap up. Okay, look for the
You mean
limited
wear the
resources.
condoms.
Oh, he meant strap up. Got it. He just said
Mhm.
resources available out there. Get tested and make sure your partner get tested as well. Same thing, kind of like what Patient
Yep.
says earlier. It's like
Mhm.
nobody care how, even if that mean like what they can call it odogu,
Right.
dogu o, igwe, chief,
Right.
Charles the first one, the last one. Like even if that person won't take care of you as a person, you want to practice that piece. My question to you, Adeline, is condom is available in Liberia?
There is condom there. You do have to pay for it. It's not freely available. And when it is, it goes fast. Like we had a few
Yeah,
that we
yeah.
gave away. Hell, to find leather latex gloves was hard. Just latex glove
Wow.
was hard. Okay. To be
Yeah.
able to have the doctors have gloves. Before
So
I
these
even say
numbers
condom.
would not. Yes. So it's the what's the word?
The whole
Insignificant.
healthcare system
I'm
is
the
it's
insignificant or whatever you want to call it. What kind of vocabulary? But this, it will not. It don't seem like it will go down.
it
But
won't.
it's
My
the
own
same.
uncle died because we didn't send the money fast enough for him to get the oxygen. They took it off of him and give it to somebody else. Like that's how bad healthcare
Yep.
is
Yep.
in Liberia.
Yes,
Yes, because you can't give oxygen to somebody else fast enough because the person family they didn't send the money, they didn't make it fun fast. They take the oxygen and give it to somebody else. So we're talking about the city, let's be clear, because the rural, you can't even touch it. From the transportation issue to get there, to
oh
the
God,
fact that
Liberia,
people
help.
don't even make it into the classroom to even sit down in school, to the fact that children are still being put into child marriages with grown men. Like
Yeah,
we didn't even touch village yet, okay? We're just talking about the area city of Morovia, okay,
and
to
this
be
is like
clear
wow, and
when
it's.
I'm speaking on these things because
Let me say this
the
number.
rural area
This is Tasi.
is harder to get
I believe
to
it.
be able to
I believe
educate.
it. I really believe it.
It's so for me, also, I'm a mental health provider. So I worked in psych at Bellevue Hospital. I've been working on what it means to be mentally well, like just all around. So when I tell you two things, and it's been from my own personal experience growing up in Liberia, poverty breed contempt in so many ways,
Yep,
right?
I agree.
And the poverty stemmed from the fact that at least this man giving me money and feeding me my
That's it.
children,
That
Mhm.
the bare
I will
minimum.
survive another
Yep.
day. Why I will be worrying about he having something when I'm gonna die
They
anyway
don't
and don't
even
have
cross their
food?
mind. They don't even care if it does cross their mind. It's not even an issue. To be a
It's not even an issue
awareness.
because the survival is what is first, right?
Yes, me and
Then the
myself.
second thing behind that, we're not taught self-esteem.
That's
We're
another
not taught
one.
self-preservation. As a grown ass woman, I just learned that, okay,
A
later in
lot
my
of
life,
Liberians lack
what
self-esteem.
it
Yeah.
means.
They will get on this app and argue with me down, and they know me. I'm always down to argue. I got day and time, but a lot of them lack
Mhm.
that, and that is the
Mhm.
honest truth.
Yeah.
And I'm not talking about just Liberian in Liberia. I'm talking about the
Let me have
world
something on it.
population.
Mhm.
Okay. A
Yeah.
lot of us have been taught that what it means to be a good girl,
Yep,
to be the listen, to be
yep.
serving
That's
to
what
other
this was
people's
initially.
needs, to not question anything. And if you question something, you're being a bad person.
Yep.
Well, all in all, it's self-preservation,
Yes.
right?
Mhm.
Even
Mhm.
in our gospel and the way we love Christ and we love to go to church and we Christian, it's all submission,
Hmm.
right? We're not taught within Christ there's preservation of
There is.
self.
Yep, I agree. There is.
We're not taught what it means to be pride within your poverty.
Hmm.
Poverty, I don't even think poverty has pride, to be honest with you, because we see what desperation does
Yes.
when people are poor, right?
You see these
It said
numbers?
there's literally statistic research on that, what poverty, like poverty leads to so much depravedness
Hmm.
within the human being that they will rather sacrifice them health to
Yep.
get food.
Yep.
Like people literally will take gun to somebody else's house knowing that they could get killed themselves just to rob, just to steal, just to hurt, knowing that they could be the attacker. But
Yeah.
to deal with that aspect of that mindset, that's a systemic, that's a 20 years of education, 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 education. That's a generational thing where you have to pass it down from the mother to the children to the next children.
My
It's
dear.
going to take everybody household to pass
Mhm.
this information.
No, that's
It's
true.
gonna take it's gonna take a culture. When I say culture, you know how the people that can be singing, you take up my panty and you know right? That type of song. We need to bring those songs back where we say, tell a man no, you're not taking your put your rubber on before you go inside me. Some bullshit like that where you know everybody want to talk and be but that's what sells these days, right? The harsh reality of these type of vulgar song. Let's do it. The something something small tete was, I forgot that song that was going around. Do the same thing again. If you got a rubber, don't come see me. You know, we can make it cool. We can make sex ed cool because that's what the kids are into. That's what
Right.
awareness means. You know, my body not for you. You can't just take it. Show me some respect. Put a rubber on anything. Whoever the artists are in Liberia that are seeing these numbers, whoever that's are popular on the YouTube and Facebook or whatever that gossip mills they have. I don't know. I see them once in a while. But sometimes a little bit of education, and we're gonna have to meet people where they are.
Yeah.
We really truly gonna have to meet people where they are. So like when one person sitting on how and say, the people they're full of HIV and they're full of this and they're full of that. How are you educating the people in your family, your
Right.
neighbors,
Right.
your friends? When you go to the interior to get your coal and all your plum there, are you talking to the people in there? It's the same thing too,
Right.
right? It's gonna take a village on the micro level. It's really gonna take like solving some of those poverty issues
Right. So
because
okay. So the viewers are in here tonight, and I'm just gonna re-emphasize a lot tonight. Ladies and gentlemen, if you're just
Sure.
joining the live tonight, we're talking about the HIV cases that is on a high rise in the country of Liberia right now. The numbers that came, they said 36,000 Liberians currently are living with or infected with HIV slash AIDS, and women are at the peak of that number, right? And Adeline has joined us today with background in nursing and just giving us some, more in-depth details, and how those numbers can look a little bit skewed because women are the ones showing up for getting tests done, while the men are chilling and cooling, right? So that is the conversation tonight, and then we're just diving into other parts that are contributing factors. We all know there's a lot of environmental stimulators that contribute to these numbers, and these are just some of the factors that she's talking about tonight. So if you're joining in, drop a comment, give us what you think. We're talking about these cases. Like it's we see in the United States too, where healthcare is at our footstep, right? Where we can walk into any clinic and get a test, but yet people are like choosing not to. People are oblivious. People don't want to. People are like patient shared earlier. Like there was a guy in Brooklyn Park that deliberately was just passing the thing down. Like what in the baloney? Who does that? Right? So it's like we are in a country where healthcare is right to our doorstep, and yet we still have these cases. And then we go to a country like Liberia where healthcare is very minimal. There's nothing there as, even like condoms you got to pay for. Where in America, you can go right down to the annex clinic or those,
You're
like
gonna get
Planned
it for
Parenthood,
free.
and
Yeah.
they can give you like, sometimes
A
they give
lot
it to
of
you
free clinics around.
free, or like even if you buy like what 199 or something, and you get like a whole that brown
Mm-hmm.
brown paper bag of it, right? So
Mm-hmm.
it's like I don't know. And so now we're just talking about like ways that as we can bring awareness to it. And I think I love that you utilize like the musical aspects because we have a lot of musicians in our small little country. That's small Miami,
Mm-hmm.
they call it. We have so many musicians. We have so many people like trying to put their music out there. It's like, okay, how can you guys put certain music that is education that can bring awareness to this case? Because this number is big, 36,000. That's a lot of
That's a lot of
that's a
people.
lot,
A
right?
lot of
And I
people.
went on Google today, y'all, and I got it said this is the current population of Liberia as we speak, right? That is
5
the
Yeah,
million.
every year they can go
yeah.
back for
So this is,
December.
I mean, this is the current population. So subtract that 36,000 for that number.
Yeah.
That's a lot. That is a lot. And it's women,
Mhm.
Definitely.
young girls, old man, middle-ish old man, middle-sized old man. All they're all in this number. But it's like where can we're the Inner Circle podcast. We're here. We try to promote like that positivity within the community by bringing awareness to certain topics or just other stuff. But like my only question is like, how can we like your brother is Abe? Like, what are some? Can you let us know where we can help? Like, what are some organizations that we can connect with our podcast and see where we can come in? I mean, someone not gonna be like, bro,
And
bro,
donate some condoms.
we can
Yeah, we'll
donate, like
buy
maybe
I
condoms
haven't I
and
haven't really, because I like to do my research before I come on this. I just saw this like I literally came home early today. That's how I saw think
well, when you do your
forever
research,
he's
know
been
your
doing
brother,
this show.
you know your brother.
Yeah, I have not, like that's how bad I've been. I've not been on his thing since he started. This is my
Yeah, do
first
look
time.
alike. I would have asked if you know Abraham. Because I got see nose, see face, literally.
Yeah, that's my first time I've been on here since he started. So I don't really have the name of the organization, but the ZOE organization is a surgical mission, is a surgical medical mission. They actually are looking for nurses to sign up. They have a trip in February that's happening where a bunch
Goodness.
of people is going to be going down to
but
Liberia
you ain't
to
gonna
do the
get me in
surgery
your
again.
country.
And they're going to be working with the Chuba Clinic.
To who?
So Chuba is the name of the clinic.
Oh, Chuba. Okay,
It's
Chuba.
connected with, oh my God, I'm trying to remember the name of the church. But the church is the one who funds it, and
Okay.
Chuba is the clinic that they work out of. They
Okay.
also just built a new surgical wing, and I think they opened their own medical school with the church too, so that way they can be able to train some people,
Yeah,
and they can
because
be,
the
they don't
nurses
have
and
to.
all that, brother, they just wearing the people in uniform for free. They ain't know nothing.
Yes. So they don't have to go to JFK or deal with a redemption no more. They have their own surgical wing now. They
Oh,
can be able to do
okay.
surgery with in-house. So they just finished building that. I think there was an article about it. But so far that's the people I work with. I know the thing the thing about sending people to random organization, I must say, too much of the items get stolen and get sold into people's private pharmacy. A lot of nurses and doctors, their side job, because Liberia don't pay for medical doctor. I'm not kidding. The doctors I know are making $150, $200 a month US. That's it. So a lot of them own their own pharmacy. So a lot of them steal shit from the hospital and put it in the pharmacy. So when you're donating to these places, mm, I'm on ground on boots with my stuff
My
and
dear,
handing
we
it
just want we. My plan is tonight because our
out.
time is only an hour here,
Hmm.
and we're almost wrapping up tonight. My thing is, we just want to say to you that the organization that you're part of, if you know any, after you do your research, please feel free to share with your brother.
I will send you, definitely will send
You
you the
can definitely
information
share
about
us with
the
us.
clinic,
You
where
know,
the
my
clinic is
class is really kind
located,
of
where people can
off.
go. Hmm. They have a in-house lab. They do HIV testing. They do the malaria testing. They do test. They have like literally guys there that do the blood work, review everything, give you the result. The clinic is not free though. I think it's like $50 or something like that. Only when they do the mission where the church is funding it, that's when it's free. But I'll send you the information for that.
Okay.
I just also wanted to state the fact that, like, I know we're talking about people in Liberia, but there's Liberian people in this country too. We still have the same mindset. So getting tested is
We
just
do,
as
girl. We talk
important.
about them every day. Like they, like I said, we have healthcare at our footsteps,
Hmm.
front door, and people are still saying that man that wouldn't mean he talking to. I not see
Mm.
nobody, but you don't know because there are a lot of men
Yeah.
that are walking STDs.
Get
Yeah.
tested. And if you feel like you want to be sexually active freely, get on a prophylactic. There's literal medication you can take to prevent getting HIV now. There's even a once a month shot, or once every 3 months. There's one for people who are HIV
Yeah,
positive. There's one
I
every three
saw the
months, one every six
commercials for the
months.
shot.
Yes. So it's preventable now if when you already have it. There shouldn't be any shame or stigma attached to if you're listening to this and you're HIV positive. Please take your medication. Either you want to do pills or you want to do the shots. It will make your life just as easy. If you're taking care of your health, you're also taking care of the people that's around you.
Hmm.
One important thing, when you're undetectable as an HIV positive person, you do not pass the disease onto another person. You do not need to pass it
Let me
onto
just
a
help you with
baby.
that, man. If you're yeah today, you're fair, yeah. If you're undetectable, you cannot pass it to the next person. And
Undetectable.
the word is
You cannot.
undetectable.
Undetectable.
This
Undetectable
one is
equals you take
detectable.
your
I will
medication
understand how to that.
every day. Every day you take your medication, you go for your lab work every 3 months. Undetectable means there's only few viral particles within so many blood cells.
Right, but it has a
And
fun.
that means it's harder for that virus to be able to pass through and penetrate and cause somebody an infection. That's what the undetectable. So undetectable equal negative transmission rates, right? So as long as you're taking your medication and you're getting your treatment, you do not need to be ashamed of it. If you get a partner, you need to be sitting there. You sure this is the person you want to be with? You can sit down and have a conversation with them
Have
about
a
it,
conversation
right?
with them.
You can even ask your partner to take a prophylactic to make sure they're also protecting themselves, right? In this country, we have access to that. So let's
Back again to
use
education.
that.
Our people with education, the resources at their footstool. You can type one word in Google. Google give you so many resources within proximity. our people choose Liberian. We have this. It's like patient will tell me something. I say, patient, please set it up for me. We don't want to. We want to be enabled to the point that when it comes to our own healthcare and us getting those type of resources, we want somebody to live for our body, get us in the car and carry us. And that is the problem that we are seeing in America, because we all go to work. Health insurance is available to you. If you can't get it through your job, the whole state, that orange pumpkin man, you know that you can apply for that and be able to utilize these services that's given to you. If you need,
And there's
there's so,
free federal clinics.
yes,
If you
exactly.
don't
That's
have
what I was about to put out.
insurance, you can look up free federal clinic in your area, and the
They don't,
discount rate could be
and
like
this is our,
$100 per visit,
yes, our
and your
problem
medication is
is,
freely covered.
you see how you're talking in when you get off on your smart card, they say, can you connect me? You will send them the link. They'll want you to fill it out for them. This is what we're saying. It's like if I'm asking for a
And they
resource,
do have places. They have social workers who can literally do that for you. If
I
you
don't want to
go
hire
into the
people.
free clinic, they you gotta go in. They literally have, because we have, think about it, people who can't speak English, right? How do they get help?
No, there is
They
help
go
that's
in.
there, but there are some people that are in that literally are basically waiting for you. So again, in the country we find ourselves, like you say, we have Liberians back home, we have Liberians in America. Where with the US, everything is given to us like right here on this pedestal. You just gotta go for it and research it. People chooses not to, and that is even scarier. So just imagine back home.
And people also need to stop being selfish. Because if you're not taking care of yourself and you're messing with X amount of people, that's being selfish, because whatever it is that you have, you're sharing it out there too. So those are some of the prevention too. Like, stop being selfish and be considerate of other people's health as well. If you know that you have whatever you have, keep it to yourself. Don't go from Musu, Kiman, Josephine, and just keep carrying it on, because you're messing with Josephine. Josephine probably gonna be messing with somebody else. Then Musu's messing with somebody else, and that's how it spreads. So we, in the African community, we need to get to the place where we can stop being selfish with each other and stop spreading these diseases. Like, for an example, what I hear when these people go back home for vacation, they go out there to run wild. They leave the spouses here and
That's
go
right.
back there and start running and doing things they're not supposed to be doing, forgetting to know that you're coming home, you're coming back home to your person here. God forbid you catch something, you bring it, then this other person catch it. And if that person is not fit for two, they carry it on to the next person. So we really has to start taking accountability for the things that we're doing that causing these things to keep spreading as well. We have to do that as an individual in order to stop this. Just
I
sit
must
in
say
one
though,
place.
our culture does reward sexual deviancy.
They do.
Very, very
Mm-hmm.
high. Very
Very.
high out of
Yeah.
wedlock marriages, very high. I'm a proponent. I've done it myself. I'm not gonna sit here and say nothing like I'm a saint. Had children out of marriage. Children are blessing, and you just sleeping with this one and that one. And
Mm-hmm.
there's certain cultures, and we can even like make it a religion where like they frown upon
Yeah.
you not being married and having children out of where our
Yes.
culture don't do that. We freely agree with sexual freedom in the way that doesn't elevate us, and it's
True.
causing more problems than it is.
Little do we know it's causing more harm than
It
helping.
it is that,
It's
and
so
that's
true.
what these diseases are spreading the way it is too,
Mhm.
because we're not sticking to where we choose to be at that moment. You're here, you're there, you're all over the place, and everybody else is dealing with somebody else too. That's how it comes together, and
Yeah,
one person catch it,
it's
they
in
carry it
our
to the whole.
song.
Yep,
It's in
the
the
whole
way we talk
community.
about this man cheating with that one. There's the way we make it into
Mm-hmm.
entertainment. We make it laughter. You know, some
Yep.
culture that shame, shame, shame. We kick you out the community. Right? You're
Yep.
degrading the women. You don't belong here. Go out. They make
Yep.
sure,
So
but
I
us,
mean, prevention. That's
it's
some of
I
the
don't
thing too,
culture.
because medication can do
Culture
what it
Medication
takes
can
a
better than
do.
lot to repair.
cure.
Yeah, that's true. Medication
How
can
to
do what
take
it
a
can
lot.
do, but keeping it tight, it's the way to go about it. Because
Right. You got
if
to.
you're taking medication, there is still a possibility that the next person might get it, and so
Oh my
forth.
God.
So
There should
let's
be like a testing station at the airport. Everybody coming, get tested. When
anytime
you
you're
leave,
coming
you
back
get
to
tested.
yeah,
Oh
there
my,
should be.
oh my
Before you
goodness.
leave it,
Yes.
I'm
Do you
not
know what
getting
that
a
Yep,
would
testing
do?
station at the airport. Come
there
in,
should be. Yep.
going out, right? You know what you brought and you know what you're
Right.
leaving with.
And you know
When
Yep.
what?
you when your
If you
December
have a
people go in,
wife,
pack all your
if
condom
you
then
have a
yourself.
wife, your results should be sent to the person
To
phone
your wife.
immediately.
Yep. Yep.
So
Yeah.
before you even get to that hole, you also get outside.
If
I'm
I had a
telling
man
you.
that if I had a man I love
That
to go back home and here, when you're leaving, we're testing you. The very first day you get back in the US, we're going to the hospital.
Before you
You're
come
gonna
to the
go get
hospital,
tested.
I will carry you to the when I pick you up
Yep.
from the
The
airport.
moment I pick you up from the airport, we're going to the
we're
hospital.
going.
If I
I
had
don't
a
want to hear
person,
your
yeah.
words,
24 hours, all
right?
night, 24 hours.
Because
And if
I
you
hear these
freely
men
share your
talking.
man and you comfortable with that, put him on prophylactic before he leave.
You and
Then
that
you carry a
medication.
medicine with him.
Yeah, that's
Yeah, because I
well
And
hear
advocated.
listen, some
honestly, I
people
hear
can
these
share
people
freely.
talking
That's their
about
thing. I
like
respect it. Okay.
going
I'm
back
not
home and
judging. If
being
you share
involved.
freely, just carry your medication with you. That's all.
Put in your put in
That
your
shouldn't even be something that somebody want to sell it for anyway. Anyway,
And it's the new age. Oh, what can I say? The people, let's be honest, the people are already doing
shoot.
it. It's not like they're not doing it. They're already doing it. You might as well give medication to stop it from spreading. Instead of pretending to say,
I might as well
yeah,
just
but
let you
just be
go so you can
faithful.
continue to do what you want to do instead of me putting myself
no,
through that,
that's true. And I think
through all that
sometimes
stress.
too, a lot of
Because that
women
once
don't.
again, that's selfish.
Yes. And a lot of women, we talked about self-esteem here. I think when we think about
Yeah.
self-esteem, we think about, oh, I'm confident, I can walk like my neck in the air. No, it's making that bold choice of saying, sir,
Hmm.
sir,
Boundaries.
Yep.
you sharing this dingling and I don't want no parts.
Yeah, I
Mm-hmm.
want no
And
part
I'm
of
out.
taking it.
That's
Yep.
self-esteem at its finest. I think we
Mm-hmm.
take the word out of context, that we take every word in the community or as Liberians out of context, but that is basically taking out both sides and saying, you know what, I like you, but you don't like me because you
You're right.
scream
Yep. Hmm. Hmm.
that wet thing, I look like that. You're just sharing it to the nations, and I want no part. And you're picking yourself. You're prioritizing yourself and your health.
Your
Your
health.
health is
Yeah.
wealth. To be honest, so that self-esteem comes back to it again. But when we talk about it, we don't even think about it in that sexual, making that decision to say, you know what, I don't want to be sexually active with this man that is all around the nation or Mr. Popular.
Right.
No,
It's
the
like all of this.
popularity is seen as the spice.
It was spice the
No.
Baha.
Everybody want
Right.
him. I want
The
him
Baha.
too.
That's the
The
spice
Baha will
will have
spice
you
it
only
up.
taking injection every month. God forbid. God for
I'm telling
I'm
you,
telling
keep
you,
your
some
spice.
women get off on the fact that
Mm-mm.
they can steal a man from another person.
I don't
Yeah.
get me wrong, and they think it's like an ego boost, and it's like you're jeopardizing
Yes,
yourself. It's like
they
it's not about
really
ego.
do.
It's about you literally prioritizing yourself because the thing we're talking about is not like some people that can get gonorrhea. They give you the medication. This is HIV that
Yeah.
goes into
A
AIDS a
lifetime
A
lifetime.
lifetime.
treatment.
Yeah. A
Lifetime
lifetime
of
When
disease.
treatment.
you if
Yeah.
people
There's no
Mm-hmm.
cure.
talk about gonorrhea, you get to the point of game medication, and they move for the other get the other one game. But this one, they buy
Yeah.
the enter, and now they work 'em.
Yes,
Yeah.
it's a
Lifetime. And then
lifetime
when you have kids, you're
medication.
pregnant,
It's a lifetime
yes.
of going to the hospital. It's a
Yes.
lifetime of taking
So
your
you're
blood
risking
work.
your life.
It's a lifetime of looking out for other people, making sure you're not
Yes.
um passing anything onto them and
Yes.
you're
Yeah.
treating yourself. So it's not a also we don't want to stigmatize people who are
No, no, no. We're just saying.
right. Get your medication, get your treatment, but we also want to prevent people from becoming,
From
Yeah.
right?
getting it. Yeah.
If
It's
you have not
twofold.
been practicing safe sex, please.
Get tested.
As an adult, get tested first and
Get
foremost. Remember
tested.
that hierarchy. And then when you get tested, if gracefully nothing is you are negative, go find a bag, go and put it in your purse, your shoe box, your car. Anywhere you want to put it.
And there's nothing wrong with
If
that.
you live
I
in
was one of those
America,
people.
I
I
think
walked. I was one of
everybody
those
to have
people. I had
You
some
know,
in
prophylactics
my
in
just put
purse.
it there.
place.
There's
And
nothing
if that
wrong with
man say
that.
he allergic to plastic, he can eat food, plastic inside. Don't go there.
Right. Yeah.
Mm-hmm.
Because
There is
listen,
not. There's nothing. Prevention is better. First of all, you gotta look out for yourself as
yes,
a human
True.
being. You have to look out
True.
for yourself because if you don't, nobody gonna do that for you. So I rather play it safe. Even if he said he's allergic, cool. That means we ain't doing nothing because if you can't, I gotta keep myself safe. I gotta keep the upcoming
Mm-hmm.
generation that I'm gonna create safe as well too. Because these are diseases that you pass down to your kids too. Because if you have HIV, there's a possibility if you get pregnant as a woman, there's a possibility that child might
If you're
have
in Liberia, you have some possibility you pass it to your child because they don't have the RCT.
right.
But here, babies haven't been positive for HIV in since the 80s.
yeah, because the
You take
medication.
The
medication while you're
medication, yeah,
pregnant,
the
and then when
medication.
you have the baby go on medication for 6 weeks or 8 weeks,
Mhm.
and then the baby no longer have to deal with
We
medication. The
thank
baby is
God.
negative,
We
then
pray
like
that
that.
one day that country that
Hmm.
looking at that in the corner there,
Can
that
get such a treatment. Oh yes.
yes, oh Lord,
Hmm.
They need to improve the healthcare system. Let's pray for them to get healthcare system
we'll
first
still
because
be praying for
right
hope.
now they don't have it at all. Let the prayer
They
start
don't
with the
have it at
healthcare
all.
system.
No.
Once the
Yeah, I'm saying,
healthcare
well, we pray for
system
the healthcare
is
system to make some
something.
improvement. But we pray,
Yeah.
like, if you're watching tonight, please just take where you can from this live tonight. Tonight is more like an educational segment. We bless.
I implore you to go do research and find the different organization that's in Liberia that's offering
No, I don't play my
testing
librarian card yet tonight. I want you to read
condoms.
it and send it to me.
I'll send it to you, but the people they can look too. Let them
Yeah,
go
let's
look
put in
too.
look and let us know. We're here
Let
to
them
You know
help
go
me,
you
you
any
gotta
research.
tell
way
I'll
her,
we
send
yeah,
it
can
to you.
you
help.
No
gotta,
problem. I'll
you
do my
gotta,
own. I'll send it to you. But right now, before I get to you, they can go online, start looking themselves.
Yep.
yes,
Find out
yes.
who your health minister is. What they doing about this number? Who advocating to the United
I
States
am
nation to
president,
get
like,
more
I'm
money?
again open again close.
We have a better he better than the last one out there.
I'm the feeling I can be that. You see them sleeping on their Facebook. I say, that the president here, it is well.
Yeah.
Yeah, and the
Yeah.
ones that's in America here, they need to go seek the
Yes,
help
if
that
you're
they
in the
need.
United States and you got healthcare,
And
let me
yep,
say this, Pete, hold on, yeah. Many of y'all, I get y'all to that people you're doing all the double, you don't have healthcare back
You
here.
don't even go
healthcare.
to doctor.
Yep.
Y'all don't go to doctor. When your neck pepper soup, like my soup, but you're not fixing everything.
Yep. Yep.
The other part of the bloodstream, pepper soup can reach that part. So go to the
Mhm.
hospital and get your self tested. I don't care if you're married to that Mason Jacob was a pup. That lady
Right.
I bought, you don't know what is going on.
Yeah.
Get yourself
It's
tested.
true.
You're being this job's working. Nobody say you can't work. We gotta get our money. We gotta pay our bills. But make sure you're also receiving health care. If you're not getting it from your
Healthcare.
job,
Yeah.
get it from like the state or some way that you can be able to have frequency in your health records that you can say, okay, last October I got a scan. This is where I was at.
Yep.
This October, this is where I'm at. All of these
Mm-hmm.
things is wealth, not just buying Gucci chain, wearing Gucci bag.
Right.
You are
If you
no.
get a full Gucci chain, get a full Gucci belt.
Right. You
Matter of
can
fact, you
afford
can get on the
healthcare.
plane
Full
and go to
healthcare.
Turkey for $900. You can get surgery, CAT scan, everything during Turkey.
Yeah.
Yes.
Medical tourism
They can
is
even get
called.
more in
Even in
depth than
China,
yes.
for
Yes.
$900, they will fix your teeth. They will do all your tests. You need surgery right there. They give it to you, including
You're
the
getting the wrong things
airfare
done.
and
That
your
will
hotel.
BBL and teeth. You'll
You
be
don't have
fixing
to
when
wait
you
for
go
a
get
high
it.
America price. You can
Yeah.
go travel to get your health care for cheap and good.
No, they're traveling. They're traveling for the different team, man, not healthcare.
That what they have to go change it now. Huh? Not just for
Well,
getting big butt or BTT. Go for the whole checkup.
right, right. But tonight, guys, we are literally going into 1 hour 20 minutes. So we're gonna call it a night. It's Friday.
Yes.
But before we go tonight, we gotta give a shout out to the patients. There are so many things that happen in patients' life.
So many
And
things.
we'll talk about it
Yes.
next week more because my girl had to do dinner, but we'll get more in depth next Friday. But tonight, we just want to say collectively, if you're in the comments, our patient got married
I
last
sure
week.
did. Last
Yay!
Friday.
Congratulations.
Congratulations to
Thank
our
you.
girl. Show us the rock, please. Flower Apple House.
Nice.
So congratulations to Patience. We can talk more
Thank you,
about it
thank
next week.
you.
And we want to say
Yeah,
happy birthday to her
definitely.
again. Not only did she get married, the birthday followed right after. So gorgeous.
Right after,
Double
yeah.
everything. You just,
I'm trying to break his account in November. That's the goal. Every
oh
November,
Lord.
I want to press
Exactly,
chakra.
exactly. She's trying to so congratulations, Pete. Congratulations on your marriage. We already said it.
Thank you.
Congratulations.
Congratulations publicly. And also happy belated birthday again. We'll be did something fun. Get a man or boy child. Hurry
I
up.
didn't do anything. I was sitting right on my couch. My sister is the
I believe
Scorpio in me.
it. But
I
yeah,
was
so I just
I
want
had
to
my
give
social hour. I was overstimulated, so I sat right here for my birthday, and that was
yeah,
it.
that
No, yeah,
but that was that. So Adam, I want to say thank you tonight for joining us.
yeah.
Thank you for the educational piece. It was really informative. We appreciate it. Your brother knows spend the teens. He can come this year and be challenging me and pitching when I
Not
invite him
small
on
thing. Not
Friday.
small hard time he can get. He can get. Oh, so I
Eh,
need to reach out to you personally so you can give me all the secret names so I can be giving
Yeah,
you hard
especially
time.
how that
I
hair
can
can
be
grow.
giving you hard time too.
no, I swear loyalty a long time ago.
Oh no, I'm not.
Patient, I cannot give you nothing. Snag if you so open.
No, my mouth can't open that way.
Exactly. And I didn't know nothing about her brother. It is well. We agree. But
Yeah,
thank
we
you for joining
agree.
tonight. Before we depart, would you please give a closing statement and Patient will give her a closing statement and we'll call it a night.
Okay, so my closing statement is definitely this number is good. It's bringing attention. Obviously, we're talking about it, so it's doing the job that it's supposed to do. Hopefully, it go further where the people who do have the power to bring in more medication infrastructure on a governmental level is able to do that, and then on our personal level, we can educate each other. We can make sure we getting tested and getting the services we need. And if we are positive, we make sure we're taking our medication, we're getting the treatment we need in this country. If you're in Liberia, fight your way to a free clinic. There are few and they are far in between, but they are available. That's my closing statement.
Thank you.
Well, thank you all. I've been gone for what 3 weeks now. I'm excited. Yeah, I'm excited to be back. November has been a very busy month for me, but yeah, we need to stop being selfish. That's one of my parting statement. We have to stop being selfish. If you know, or even if you feel funny, just go to the hospital and go do that test. And if you know that you have what you have, don't go spreading it around to other people. Get the treatment that you need and make sure whoever that you're getting involved with, you let them know that this is my situation and give them the opportunity to say, oh, I'll go on treatment too. I like you and I still want to be involved with you. We need to get to that place where we can do that for each other because at the end of the day, we're all Liberians, we're all African, we all come from where we came from. And if we don't help each other out, nobody's gonna do it for us. We need to stop with this I mindset and turn it into a we thing. It takes a village. The only way like we're gonna progress, or the only way this thing's gonna stop sparing is when we come together as a team and put a stop to it and get all the necessary treatment and resources that we need to continue going as a village. So that's yeah.
Thank you, ladies.
Yeah.
I agree with both closing statement. I mean, I don't have much to say, but I agree with everything you ladies said tonight. Once again, this is social segment Win and Patience. We're glad Patience is back. We're having a good time.
Back.
But Adeline, want to say thank you for joining. You know, you're very informative. We really appreciate your presence here tonight. As your brother, we didn't even know you had sibling. But
We did not.
we'll talk about it in the group
We be
chat.
hiding in the
Yeah.
woods.
Oh yeah. I come and go
Apparently,
grill
it
him
seems like
goods.
here thought you're a whole nurse around here. He be acting like saying, I get cuckoo put behind. Like,
Yep.
but anyways, we love him. We want to say thank you guys for joining. This is our social segment. We're gonna call it a night. Join us again next Friday, the day after Thanksgiving, and we have a very hot topic next week. But tonight we had to bring awareness to these numbers, and I hope everybody do their research. Don't just go with the numbers. Do your research, go in depth, and get more educational background. And educate yourself so you can be able to have proper conversations around that. So have a good night, happy Friday, and take care,
Nice
everybody. Good
guys.
night.
Happy
Take care.
Friday.
Bye.